on average, only 12% of patient illnesses are correctly diagnosed by primary care providers.
Diagnose, which means that 9 out of 10 are given the wrong diagnosis?
Yes.
Oh, man.
Medical errors are actually the third leading cause of death in America. 1 in 3 misdiagnoses lead to serious injury or death, and these screw-ups cost the economy billions of dollars.
Alveoli around on the wall is increased, so it swells up inside. Actually, the alveoli becomes closed, so oxygen can't get in. You're breathing. That's how they go, really. And then, within minutes, as soon as that happens, there is, when we chop it off and do the postmortem, we see it's red. That's called consolidation. It's called red hepatization. Because the blood is coming, it's chopped up, and the patient is dying because he had a heart condition, and then the early stage of pneumonia we find. It looks like cheese, it looks like liver. Okay? It's not like sponge. The next thing is what happens, all the cells die and the white cells, the RBCs, release black pigments from the hemoglobin and it becomes brown. And that's called brown hepatization. So this is the consolidation, red hepatization, brown hepatization, and then comes the resolution. Few days later, the white cells have won, all the cells have been killed, all the white cells have conquered and killed all the germs. They have to be coughed up. Because they're sitting inside the alveoli, they have to be thrown out. So you start coughing. The pneumonia patient who actually got a chest infection is getting better. He doesn't need the antibiotic at that time. He needs the antibiotic before. And moreover, if you give oral antibiotic, it's not going to work. Chest infection, giving oral antibiotic is simply a waste of time. Why? Because the blood circulation is reduced. It increases, but it cannot carry enough antibiotic into the area. And the other thing is antibiotics don't get into the pus. It just colonizes outside and kills all the germs outside. And the bacteria will multiply, get into the blood, and you get septic and die. 44,000 people are killed, average age is 23, are dying in UK because they missed an infection. And that's called sepsis. Please go and read it up. It's a disgrace for my profession. If I had one patient in my list who died of sepsis, I would have given up medicine. I'm not good enough. And that is important. Then later on, you go, what can we do? We did the antibiotic, it didn't work. Nonsense. You didn't give the antibiotic because it had to go by mail. You needed to find which antibiotic works. By giving penicillin 250 milligrams or 500 milligrams, you are just covering yourself. It's a lie.